And I think most officers who get into law enforcement do that with the whole idea of serving others and the protect and serve, the mantra that we go by. And sometimes we don't realize that to serve and protect others is dealing with some of the most vulnerable individuals in our communities. And many times those are individuals who have mental health issues. And had many instances, we'll go on calls that today I can look back and I see where the individual that we were dealing with was in a mental health crisis. At the time, though, did not have the training nor really the tools to deal with that person or somewhere to take them. In 2009, a group of individuals and agencies, ultimately we called ourselves or named ourselves the Community Partnership on Mental Health, was developed, and a group of us, about 20 different organizations, got together to look at how law enforcement was responding with the mentally ill in our community. Having a large state hospital there, and being an area that we have a large number of individuals who have had mental health issues in our community, we wanted to try to see how law enforcement interacted with them and to see if there were better ways to deal with individuals who were in crisis. So our group started meeting and we started talking about what that would look like. We went through several ideas, and today we kind of joke because we really don't remember who said, hey, what about CIT? We looked at trying to start a CIT program really as a two-pronged approach. One was the actual training of the officers, and the second was establishing a single point of entry where officers would be able to take a person who was in a mental health crisis for them to be evaluated. And since that time, we have literally had a couple of hundred people that have been CIT individuals, people who a CIT officer dealt with on the street and made the decision that they were a danger to themselves or others and they were in need of an evaluation. And we have transported that individual to the CSU in order for that to happen. Many times these individuals are only there for a short stay, get them on some type of medication, consult perhaps if they already have a diagnosed mental illness with their providers, and those individuals are placed back in the community, back with the community mental health or with their own doctor for follow-up. We believe this has been the very thing we were attempting to do, which is to keep individuals who need mental health assistance out of jail and in a medical service or provider that can help them with their need.
It is ever important that we not lose sight of the effects of mental illness on our families, our children, our parents, our loved ones. And if I were about to arrest someone and the effect of putting them in jail because they were diabetic, because they had a heart problem or other physical challenges, well, you would think how horrible that is, how ridiculous that might be, but here we are continuing to do that with those that suffer from a mental illness. So we're about changing. Again, I want to applaud Meridian PD, Lauderdale PD. Chief, thank you for having Jackson PD here today.
As a law enforcement officer, and taking the oath to protect and serve, I did that for everyone. So if we can help a person with that need in our community by either placing them at a crisis stabilization unit or connecting them with the local community mental health provider, we're doing something that fulfills our oath and helps us to be better officers and helps our community at large.